When does a woman ovulate, and how can you know if you are ovulating? Welcome back to the FemHealth channel, a medical education channel by doctors for you. I'm Dr. Erica Montes, a board-certified OBGYN, and today we're talking about when you ovulate, how to know if you're ovulating, and how the timing of ovulation impacts getting pregnant. Ovulation is the part of your menstrual cycle when your ovary releases an egg. You may have heard that this happens on day 14 of your menstrual cycle, but that only applies if you have a 28-day cycle. And even in people with 28-day cycles, may not be able to predict ovulation based on your cycle length alone, which is where ovulation trackers can be helpful. Also, cycle lengths can vary from person to person. If your cycle is shorter, ovulation may happen earlier, but if your cycle is longer, it could happen later. For example, in a 30-day cycle, ovulation may happen around day 16, while in a 24-day cycle, it could happen as early as day 10. So, knowing when you're ovulating is important if you're trying to get pregnant or trying to avoid it. To know when you ovulate, first track your menstrual cycle. Day 1 of your cycle is the first day of bleeding. It is not when you start spotting. The first step is to understand how long your cycle is. You should count every day from day 1 until the day before your next period begins. That number is your cycle length. Now, your cycle length can change from month to month, so you will want to have a reliable average. Also, you should track your cycles for at least 3 to 6 months. And once you know how long your cycle usually is, you can estimate when you ovulate by subtracting 14 days from your average cycle length. This will give you a general idea, but tracking physical signs can also give you a more accurate picture. There are several ways to track ovulation. One of the easiest is by watching your cervical mucus. As you approach ovulation, your body produces more mucus that becomes clear, slippery, and stretchy, kind of like a raw egg white. This type of mucus helps sperm move more easily through the cervix towards the egg. Another sign is a rise in basal body temperature. After you ovulate, your body temperature increases slightly, by about half a degree to 1 degree Fahrenheit. And you can track this by using a basal thermometer every morning before getting out of bed. Over time, tracking your basal body temperature can help you see a pattern and confirm when ovulation happens from month to month. Another very effective way is by using ovulation predictor kits. This tests your urine for a surge in luteinizing hormone, also called LH. This surge usually happens about 24 to 36 hours before ovulation, and a positive test means ovulation is near and you're in your most fertile window. If you're trying to get pregnant, you should have sex during this time. If you're trying to avoid pregnancy, then you should avoid having intercourse around this time as well. Now, it is important to remember that while ovulation is a one-time event during your cycle, sperm live in the female reproductive tract for several days. In fact, they can live in the female reproductive tract for up to 5 days. The egg survives for about 24 hours after ovulation, meaning that your fertile window is typically about 5 to 6 days long. This fertile window roughly starts 4 to 5 days before ovulation and ends about a day after ovulation. And the highest chance of pregnancy comes from having unprotected sex in the 3 days before ovulation and the day of ovulation itself. To avoid pregnancy using fertility awareness, you should either avoid sex or use a barrier protection during this window. For example, if you ovulate on day 14, avoid unprotected sex from day 9 through 15. The effectiveness of the fertility awareness method depends on how carefully it's used. With perfect use, meaning you track your cycle precisely, monitor your symptoms consistently, and avoid or protect against sex during your fertile window, it can be up to 98% effective. However, with typical use, which includes occasional tracking mistakes or unprotected sex during the fertile days, the effectiveness drops dramatically to 76 to 88%. This means that 12 to 24 out of 100 women using this method in a typical way may become pregnant over the course of the year. Remember to chat with your personal doctor about your cycle if you have concerns or questions.